I'm Mr Zaid Shalchi, and today we're going to be talking about choroidal nevi. So these are benign, that is non-cancerous growths of the pigmented cells in the choroid of the eye. The choroid is an essential layer that supports the healthy functioning of the retina. Choroidal nevi are very common, and they can affect up to 10% of the white Caucasian population. Choroidal nevi are typically found as an incidental finding when someone's having a routine eye test with their optician. In most cases, people will not have any symptoms. So when they are found, the optician will typically refer the patient to an ophthalmologist, and this is a very common thing that happens, and this may be the reason you're watching this video today. The ophthalmologist will want to dilate the pupil to have a good look at the back of the eye, and they may well want to do some further tests to really understand the choroidal nevus very well. Some common tests that are done include things like color photography, especially wide field imaging with a camera called an optos camera. This is very useful to document the appearance of the choroidal nevus and document any change over time. Another test that's commonly done is called autofluorescence imaging. This is a very bright light that helps, again, understand the lesion better. OCT scanning of the back of the eye is a very common test that we do in clinic. This is a very fast way of getting lots of very detailed images of at the back of the eye. And we also do ultrasound B scanning of people's eyes. This is exactly the same sort of scan that pregnant ladies have to look at the health of their baby. Once all these images are done, the ophthalmologist will then score the choroidal nevus on a very useful scoring system called a MOLES scoring system, M-O-L-E-S. This is a scoring system that helps identify choroidal nevi in terms of their risk of ever becoming cancerous or worrisome. The scoring is done out of 10, and the Royal College of Ophthalmologists classify nevi based on their score out of 10. So a score of 0 out of 10 is a very common nevus, and this can very normally be reviewed by the optician every year. A score of 1 out of 10 is a low risk nevus, and this can be monitored by the optician or the ophthalmologist. If the score is 2 out of 10 of the MOLES score, then this is a high risk nevus, and this will need to be monitored by an ophthalmologist regularly to look for any signs of change. And if the score is 3 out of 10 or above, then this is classified as a probable melanoma, and this will need to be referred to a specialist centre for ocular oncology. There are 4 in the UK, and there's a very good one in London. Now, how are choroidal nevi managed? So most nevi will never cause a problem, and the estimated risk of transformation or becoming cancerous is less than 1 in 5,000. And so they can be safely be monitored by an optician. Should they have any features that increase this risk, then they'll need monitoring by an ophthalmologist. A very, very small group of nevi will be deemed to be high risk or probable melanomas, and these will need to be referred to an ocular oncologist for further review.